wake up in the morning with burning eyes, kind of like there's sand in it. They just feel dry, just like you had dry eyes all night long. Why is that? Well, if you want to find out the answer, keep watching. Hello everyone, I am Dr. Rupa Wong, board certified ophthalmologist, and on this channel we talk about eye health, eye surgery, eye makeup health, and a little bit about my life here in Hawaii. So if any of that interests you, make sure to hit the like and subscribe buttons so you can follow along. All right, do you feel like your eyes get so dry at night? Way worse than they do during the day. And so then you wake up in the morning and they just feel crusty and just not refreshed. It can really impact your quality of sleep. Why is this happening to you? Well, there are a bunch of different reasons, but first, let's talk about dry eyes to begin with. Dry eyes is when you are not either making enough tears or your tears are evaporating too quickly. And your tears are actually made up of 3 layers. They are not just made up of water. There is a water layer, an aqueous layer, that's the middle layer. There is a fat layer, and then there is an oily layer. So there's 3 different layers to your tears, and they need to be in perfect equilibrium so that your tears are healthy, they stay around a long time, they lubricate the surface of your eye, they re-wet them and make them feel good, as well as giving you clear vision. So dry eyes can be extremely uncomfortable to deal with. I know I've experienced it as well, especially since I'm an over 40-year-old woman, and it just tends to happen I don't want to call myself middle-aged, but I guess technically that might be the term. It tends to happen more in women like me than in men. And I have a whole video about women and dry eyes, and you can check that out here. So symptoms of dry eyes, what are you experiencing? Stinging, burning, scratchy feeling in your eyes, light sensitivity, irritation, redness. You might not even be able to wear your contact lenses because the eyes feel so uncomfortable. Blurred vision. Difficulty with your nighttime vision is a key one, and eyes that water. This gets my patients all the time. They come in and their eyes are like watering, and then I tell them that their eyes are actually dry, and it seems so counterintuitive, but your eyes are watering because it's your body's way of trying to combat the dryness. So it makes these reflex tears, and they're just not as good as your natural tear production at the basal level. So that's why we always want to try to fix the different layers of your tear film that are not working properly. If they're not in perfect equilibrium, then that's what we want to target instead of simply trying to replenish. So what's causing your dry eyes to get way worse at night? Here's a big reason. I'm going to tell you, and it's something I fall culprit to all the time too. And it's all the screen time at night, especially if you are like me. I'm a binge watcher. I will watch all my Netflix shows in bed at night. We don't have a TV in our bedroom. This is my bedroom, so the opposite wall, where I guess a TV could be, but we'd always said, my husband and I, we didn't want a TV in our bedroom, but then now we're just in our beds watching our iPads. So what happens when you are on a device, whether you're watching on your phone or just scrolling or watching like I am a couple hours at a time on your iPad? You tend not to blink as much when you're engaged in screen time activities. So that makes your eyes dry out more, because if you blink less, your tears are going to evaporate, and it really requires a nice healthy blink to force the tears onto the surface of the eyes. You're not blinking as much, your eyes get dry. Some people actually sleep with their eyes open, and this has happened to me once or twice. You probably can tell if this happens to you because you might wake up with a significant amount of tearing in one eye, and it's really painful. Usually it goes away after about 15 or 20 minutes. Typically that's because you've slept with your eyes open and that area of your eyes is really exposed. Now, some people do this chronically, and if that's you, then I'm going to talk about what you need to do so that it doesn't become a problem, because it's not just uncomfortable. If your eyes are always exposed at nighttime, that can actually lead to severe drying, which can cause a penetration in the front surface of your eye, and that's really bad. If you wear your contacts for too long, you know who I'm talking to. Contact lens users, you wear them 16, 18 hours a day, maybe even still when you're in bed watching all your Netflix or Hulu shows. That prolonged contact lens use can further dry your eyes out. Environmental causes, if you have a fan like I do, or a air conditioning unit. Both of those things can really dry your eyes out, and typically that happens when you are sleeping as well. And there are a lot of medications that sometimes cause worse dryness at night. This includes antihistamines and decongestants, hypertensive medications, both of which I'm always on, hormones, drugs for gastrointestinal problems, pain relievers, antidepressants, certain skin medications, antipsychotics, and even chemo can really make your eyes dry. So what do you do about this? What can you do? Maybe you're on medicine. I can't stop my hypertensive medication. I have got to have some AC because I live in Hawaii, and gosh, it is so hot everywhere right now. We all need AC or a fan or something. What can you do if your dry eyes gets worse at night? Well, of course, screen time is one thing that you can control. Second is to stay hydrated. The more hydrated you are, then the better your tear film is as well. That just stands to reason and is also backed by science. Even if you don't wear makeup, making sure to wash your face and specifically your eyelids every night, if you're a man or a woman, doesn't matter. That's going to really help open up the natural oil glands in your eyelid so that your oil is producing that oily layer for the tear film so that your tears don't evaporate so quickly at night. So make sure you do a good job cleaning your face and your eyelids every night. A humidifier is a great option to have in your room just to provide some of that moisture into the environment so your eyes don't get so dry. Another thing that you can just buy over the counter without a prescription is an artificial tear ointment. This is called Refresh PM, Lacrolube. You don't even need a prescription, just ask the pharmacist. Squirt a little bit of the ointment in right before you go to bed. It does blur your vision a little bit. It feels almost like Vaseline, but it's going to provide a moisture barrier from your tears evaporating so quickly. Not guarantee you're going to wake up in the morning, maybe just a little bit of gunk because of the stuff in your eyes, but your eyes will feel a lot better. And then if you really have a significant problem, there are things called moisture goggles that you can purchase online. Warm washcloth in the evenings before you go to bed and wash your face, as well as adding omega-3 vitamins are a couple other easy things that you can start instituting into your nightly routine so that your eyes don't get so dry. Now, if you have a significant amount of lag ophthalmos, that's when your eyes just don't stay closed at nighttime. And there are a lot of medical conditions that can be associated with this. If it's very severe, you might actually need to see an oculoplastic specialist. So those are ophthalmologists like myself, but they've done fellowship training in just the eyelids. So sometimes they need to do certain eyelid procedures to help weigh down the eyelid so that it doesn't keep popping open at night. So that surgery might be necessary. Hopefully you can do some of these other things in the meantime and it doesn't come to that, but for serious conditions, it absolutely does. All right, guys, that's it for today. I'd love to hear it. Have you experienced dry eyes that get significantly worse at night? Drop that in the comment below and what you've done to help improve it. Might help somebody else. If you have any specific topics you'd like for me to review, also drop that in the comment below. I read every single one. I try to make videos based on your recommendations. Until next time, I'm Dr. Rupa. Bye for now.